Hi, my name is Vicki Comegys. I am adding comment as a hemp user for the last 3 years and how the new law will impact me. Um, I had long-term COVID, which caused me to have double hip replacement, and our medical system was not able to provide me the relief that I needed during that time without harsh drugs. And at that time, I started using Delta 9 to help alleviate the pain without having to go on tramadol and some of the other meds that had been prescribed for me. The issue with the law right now is, for me, is the amount of servings per container. My dose that I use is 5 milligrams, so that can be to 2.5. But now with the new law in the state of Iowa, to get a 4 milligram is not the dose, it's 5. So how do I come up with the 2.5 and 2.5 based on what's being made? We'll see what happens. But the big thing is the dosage or the amount per container. With only being able to have 10 milligrams per container, that means I need 15 containers per month. So not only is it going to be extremely more expensive, for environmental purposes, it is horrible for the amount that we'll have to have now. It's a great product, 62 years old, have many peers my age that use this product for wellness as opposed to medical. And I hope that you would consider the amount per package for us that use it on a daily basis for sleep and whatever else it might be that ails people. Thank you.
Yeah, that would help. Sorry about that. Good morning. My name's Laurel Muting. I'm the prevention director at Heartland Family Service, and I am happy to have this opportunity just to comment on rules for the consumable hemp law. We are very much in support of this legislation and very much in favor of it, rules being the way the legislation was intended, especially limiting the dosage and the amount per package. These types of products really contribute to our drug culture in our communities. And that's, our whole goal at Heartland Family Service is to prevent people from having problems with addictive substances. And so that's we would just really appreciate the rules being as strict as the law and the legislature passed the legislation. So thank you.
Good morning. Are we ready to go?
Yes, please go ahead.
Yeah, thank you once again for this opportunity. My name is Andy Krieger with Green Goods Market and Greenhouses based out of Jefferson, Iowa. We are a registered, we have a grow license in the state of Iowa, and we also have a consumable hemp license from a retail standpoint. So the only comment I would like to say briefly this morning is how since July 1st, the economic impact, what it has had on our retail business. Because of the publicity and because of the limbo that the retailers are in, the growers are in, and our customers are in, the economic impact has been devastating. Literally has taken our business from the consumable hemp standpoint down to zero. Our customer base is not, as the previous person said, the drug culture. Our average age is anywhere between 65 and 68 up to 80, looking for relief, lowering inflammation, lowering anxiety. Definitely not the drug culture that was referred to. Our customers love the products that we offer, and it's just the economic impact that this position that we're all put in right now has been, quite frankly, devastating. So appreciate the opportunity to have a quick comment. Thank you.
Can you hear me?
Yes.
Good. The reason that these hemp products have become so popular is because the state medical program is not legal under federal drug law. So expecting people to use these products in the medical program requires them to register as federal criminals. And so That is why this hemp thing has become so popular. It's not just like you have to look at the whole thing in context. So I know the department can't do anything about the legislation, but I would encourage the department to keep in mind why people are using these products, like the previous speaker described the medical use that she was using it for, why they're doing that, and how the state has driven them in that direction. And so if the department has any liberty whatsoever to construe the statute, err on the side of giving these people a break, because they're not doing this at random. It's planned that way. The state did a horrible job with this medical program. It could be reconciled with federal drug law, but they won't even. Well, the state sent some flimsy letter asking the DEA to not withhold federal funding. Like, how's the DEA supposed to even understand what that letter meant? But anyway, so I would just encourage the department to listen to the patients, and they're not using this for recreational purposes, and they do have a valid reason for not wanting to register as federal criminals under the medical program. Thank you.
This is Elizabeth. Can you hear me now?
Yes.
Okay. This is Elizabeth Baird, Ames, Iowa. And I would like to second the comment from the gentleman from Jefferson who noted that his clients of his business were older people generally, but looking for pain and relief. And I know that the 10 milligram limit on both balms and tinctures, which I'm not sure if it's part of the rules or the law perhaps, but it limits those that are just looking for a small serving to address pain. Thank you.
Thank you.
Okay, Victoria, I presume you're the host?
Something like that, yes.
Okay, and this is a hearing specifically on the new legislation to regulate THC and beverages and other products and stuff in Iowa?
This is not a hearing on the legislation. This is a hearing on the Department of Health and Human Services administrative rule.
And that rule specifically is? You mean the rule related to the legislation?
That's correct. Did you have a comment?
Well, I did that. It's a Partnership for Healthy Iowa. We strongly support the legislation. I mean, our research shows that the next emerging epidemic of substance use disorder is going to be related to THC, and anything that can rein in the exploitation of another addictive substance in Iowa is certainly something we would support. I don't see any way to avoid the dangers any more than if we were looking at expanding access to alcohol or nicotine or any other dangerous drug, and especially with the tremendous impact on youth, which is now showing a favoritism nationally in every place where access is granted. And the other side of the coin is the portability of these products makes them very, very hard to regulate, whether they end up in somebody's refrigerator and kids can access them. I mean, at the beginning of alcohol problems for youth were simply easy access. And that's what this legislation does. So we hope that the administrative rules do everything in their power to make sure that these are managed effectively as potentially dangerous drugs. Potentially, I say, like alcohol, a percentage of people can be users without suffering, but that percentage, that 20 or 30% that becomes a problem with abuse, we certainly want to make sure that we limit access to youth and people under 21 years of age. And I would say that we need very, very severe rules that penalize people for violating that public trust. I guess that's enough. That's all I have to say. Thank you very much.
Okay. I just want to comment and say that this is a very misunderstood industry, and the lack of knowledge and education and facts that aren't being thrown around, it's just wildly inaccurate. The FDA has released several statements about hemp being a non-addictive substance, and our stores and businesses are health and wellness-based industries. This is not something that is part of any type of drug culture at all. And in fact, it does the opposite in promoting getting people off of some of these bad drugs like opiates and other addictive chemicals, not cannabis.
Thank you. Do you have me?
Yes, we hear you.
Thank you. I wanted to tack on to what Vicki had said earlier, that the 4 milligram per serving and 10 milligram per container, it's not only eliminating products that individuals in Iowa have access to, and I have had access to for the last 3 years, with safe and compliant product from compliant retailers under the Iowa Consumable Hemp registration program. These products have been selected by individuals for use for a variety of applications, from relaxation, sleep, inflammation, aches and pains, both promoting as well as decreasing appetite, focus, anxiety. I mean, the list goes on. Not only is a 4 milligram serving and 10 milligram per container eliminating it from shelves at Iowa retail locations and from consumer access, it's effectively pushing this business for a premium price to individual consumers online to purchase these products, which are completely legal federally and therefore completely legal for these companies to continue to sell into Iowa, just not within Iowa. Iowans looking for these federally legal products can also drive to any of our neighboring states to purchase these legal products from retailers there carrying them. I've personally been acting for the last year and 8 months for a distributor with all of these products, from gummies and chocolates to beverages. Many of them have an audience, if you will, of middle-aged women. Beyond that, adult men and women used for relaxation, for something new, something outside of alcohol that is, at every event and gathering that we attend day in and day out. This is not the audience or the following being portrayed by these silly rules being implemented and by the media surrounding these products. Also, to the contrary of many of these comments today, THC is not an addictive drug. And just like you would put your can of or 10 of chew out of reach, or your beer on the top shelf, or in a different refrigerator altogether, you need to have some simple responsibilities with the products you're choosing to purchase. These products are for you should have a simple conversation with your children. These products are for adults only. This is not the first time the world has seen an intoxicating product. It's not the first time one has been introduced. I'd venture to guess that there are far more dangerous, intoxicating, and addictive products in your house currently than these hemp products. Take responsibility personally. Don't try and drown an entire industry because you can't seem to act responsibly personally. The 4 milligram serving is a mockery to anyone with knowledge of the industry, from a variety of benefits by individuals from a wellness standpoint, as well as products aimed at relaxation and recreation. A 4 milligram cap by the state and our so-called leadership is a laughable mockery. That's all I got for today.
Good morning. I think I'm connected now. Can you hear me now?
Yes, we can.
Okay, thank you. I just wanted to take a moment to advocate on behalf of our customers. Many of our customers, which as I'm also a business owner, I own Beyond CBD in Des Moines. And as stated before, most of our customers are middle-aged customers. We don't have many young people coming in. Most of our customers are looking for relief from pain and anxiety and not party drugs. Most of our customers are also middle income to low income people. And we have heard many times over and over that even with a medical card, they cannot afford the state-run medical program. So they continue to shop with us and other stores like us because it's more affordable. This law creates a state-run monopoly and eliminates the freedom of choice for Iowans looking to have access to these products for their own health and wellness. Thank you.
Thank you. And we have about 5 minutes left in this public hearing. So if you'd like to make your comments, please use the raise hand function.
Are you able to hear me?
Yes, we are.
Hello, my name is Corey Coleman, owner of Sky High product line, made with all natural ingredients, including the cannabinoids used, including all natural THC derived from legally grown hemp, not a lab-made form of THC known as an isomer. All of our products are 10 milligrams of THC per single serving, making them now illegal as of July 1st in Iowa, but federally legal to ship anywhere in the United States. All of our packaging on all 5 flavors of our full spectrum gummies and 3 flavors of infused sparkling, and to make new products for the new standards issued by HHS would require us to have a 172% increase in packaging costs. If that was to be passed on to the consumer, the increased amount of packaging then would raise the cost of a 100 milligram package of THC and 300 milligrams of CBD to make an equivalent packaging meeting the new standards for Iowa would require that $19.99 retail package now to be increased 172%. Our business saw a dramatic increase in revenue over the last 3 years, having a 299% increase in revenue last year. This year, due to these new proposed regulations that started in February and now enacted as of July 1st, our business is now operating in a negative due to these economic impacts with regulations. Our business is mainly to distributors. We do not focus on consumers. We have a distributor-based model with roughly around 200 locations throughout the state of Iowa. Because of these regulations, the normal order size has gone down drastically because no one wanted to get stuck with inventory or be caught in the regulatory limbo that we are now with product that does not meet the specifications for Iowa. Our business has been significantly impacted to where we are operating in the red today to still make it hopefully next month. I yield the rest of my time.
Oh, let's try it again. Okay. Can you hear now?
Yes.
Hi, my name is Suzie Hatfield. I'm one of the owners of Center CIV Plus. We're seeing so many customers come into our store that are now they're just ordering online. We're sending so much of our tax revenue out of state for no reason. It's one of the most heartbreaking things to see how devastated our stores are because of this new law. I think that there's an easy, happy medium that we can all come to make this work for everyone. But if it stays like it is, we're going to all really, really have our businesses hurt. Thank you.